Iowa seek recognition.
Mr. Chair, I have an amendment at the desk.
The clerk will designate the amendment.
Amendment number 123, printed in Part B of House Report number 118-272, offered by Mrs. Miller-Meeks of Iowa.
I rise in support of my amendment number 123.
Gentlelady will suspend. Pursuant to House Resolution A64, the gentlewoman from Iowa, Ms. Miller-Meeks, and a member opposed, each will control 5 minutes. The chair now recognizes the gentlewoman from Iowa.
Thank you, Mr. Chair. I rise in support of my amendment number 123, which seeks to ban funding from going towards funding the Centers for Disease Control and Prevention's firearm injury and mortality prevention research. President Biden requested $35 million for this program in his fiscal year 2024 budget request, which is a $22.5 million increase from fiscal year 2023. Mr. Chair, I was the Director of Public Health in the great state of Iowa before coming to Congress and a practicing physician for decades. I not only have served in public health, but I value public health and believe that robust public health infrastructure nationwide is crucial to the health and well-being of our country. That's why I released a request for information earlier this year on how to strengthen and reform the CDC to ensure that our nation's leading public health agency is performing as it should. Part of evaluating our public health departments is realizing when there are programs that do not add value or belong in the public health landscape. The CDC was originally created in 1946 as the Communicable Disease Center with the mission of preventing the spread of malaria or other communicable diseases. Since then, the agency has grown into a massive bureaucracy and now is the Centers for Disease Control and Prevention with a $9 billion budget that supports research and initiatives which are not within the communicable diseases landscape. And as we saw, there were failures of this institution in both the initial testing for COVID-19 and in the response to COVID-19. My amendment is an important first step in costly programs at the CDC, which urges the CDC to get back to its main mission and to help prevent a pandemic in the future. With that, I reserve my time.
Gentlelady reserves. For what purpose does the gentlewoman from Connecticut seek recognition?
Mr. Chair, I claim the time in opposition.
Gentlelady is recognized.
I rise to claim time in opposition to this amendment. The amendment would prohibit the Centers for Disease Control and Prevention to conduct or support any firearm injury and mortality prevention research. Stat. Firearm injury is among the 5 leading causes of death for people aged 1 through 44 in the United States, and the leading cause of death among children and teens aged 1 through 19. Let me repeat. I have to repeat the last statement. Firearm injury is the leading cause of death among children and teens aged 1 through 19. The gentlelady said, this is not about public health. Leading cause of death among children and teens aged 1 through 19. This is all about public health. Unless we don't believe that death is a part of, or the causes of death are a part of public health. Maybe that's true. And this amendment to prohibit CDC from conducting research on the leading cause of death of our young people to a bill that already removes the funding for this research. This amendment is absurd. Read the bill. Collecting timely data, addressing the gaps in knowledge around this issue, and identifying effective prevention strategies are needed to keep individuals, families, schools, and communities safe from firearm injury and death, and to enhance safe firearm practices. CDC is supporting a diverse portfolio of research projects to advance our understanding of the characteristics, the risks, and protective factors of firearm violence, suicide, unintentional injury, and the effectiveness of interventions to prevent firearm-related injuries and death. Injuries and death, public health. Many funded research projects focus specifically on youth or will have implications for youth, while others are relevant for specific populations at elevated risk for firearm violence and suicide, like our veterans and those who have been victims of violence. I fought to establish this funding line in fiscal year 2020, and I will continue to fight to ensure that this funding is included. We should be united in finding ways to save lives, to end gun violence, and not play partisan games with this critical research. I urge my colleagues to oppose this amendment, and I reserve the balance of my time.
Gentlelady reserves. Gentlelady from Iowa is recognized.
Thank you, Mr. Chair. Again, I would like to say that the mission of the CDC should be to combat communicable diseases. As we saw during the COVID-19 pandemic, the agency had lost part of its focus and has been distracted. There are multiple agencies that collect data on gun violence and also interventions and strategy and research. I think that we can refocus the CDC on its true mission so that another 1 million American lives are not lost in the next pandemic. With that, I yield the balance of my time.
Gentlelady yields back. Gentlelady from Connecticut is recognized.
I just want to make one point. I'm opposed to this amendment, obviously, because it's an absurd amendment. Firearm injury, leading cause of death among children and teens 1 through 19. Public health. This is all about public health. Let us not turn it into a debate or a discussion on anything else. And what this says to me is there really isn't a desire or the understanding of what we try to do to save lives of teens, of adults, of veterans, or anything else, which really falls into the litany of amendments that we've seen here tonight that would put people's lives in danger and don't use the resources that we have through this labor HHS bill, which we have used in a bipartisan basis in prior years to save lives. This is one more example of how we believe that maybe the lives are not worth saving. Oppose this amendment. I yield back.
Gentlelady yields back. The